My name is Margaret Reynolds, and I am an assistant professor in ophthalmology and visual sciences at Washington University of St. Louis and St. Louis Children's Hospital. I'm a clinician scientist, so I see pediatric patients in the clinic for childhood eye diseases. I also conduct clinical research to see what we can learn about childhood eye diseases by working with children affected by these diseases. My main research focuses on how decreased visual acuity impacts development. We study how both reversible and irreversible visual impairment affects development. First, some children have visual impairments that are irreversible. Children who have decreased visual acuity can suffer from developmental delay and decreased school performance. Over 700,000 children in the United States have decreased visual acuity or low vision, which is defined as any type of vision loss that cannot be corrected with medical or surgical treatments. When these children become adults, they are more likely to live below the federal poverty line, they are more likely to be unemployed, and they are less likely to have health insurance. And while some evidence supports low vision rehabilitation in adults, there's very little research on low vision rehabilitation in children. This is important because children experience unique difficulties when they have decreased vision as they are continually acquiring developmental milestones. Many different diseases cause low vision in children, but one of these diseases is retinoblastoma. Retinoblastoma is a tumor inside the eye that is both life and vision threatening. Fortunately, children with retinoblastoma in the United States have an excellent prognosis with survival exceeding 95%, but more than half of these children are left with some visual deficits. From our prior work, we know that child retinoblastoma survivors have high rates of school difficulty. We are currently studying the types of vision problems school-age retinoblastoma survivors experience, such as difficulty with contrast sensitivity, which is defined as distinguishing an object from its background and known to be important for mobility. And we're studying how rehabilitation with occupational therapy can help improve how these children function in their everyday lives. Next, I study how reversible visual impairment affects development. Specifically, I study how improved visual acuity after refractive surgery impacts the phenotype or the behavior of children with autism spectrum disorder. When children need glasses but they refuse to wear them, they can experience substantial visual impairment. Typically, glasses are sufficient to correct refractive error, but there's a subset of children who refuse to wear glasses even though their vision is degraded to the point of legal blindness. Often these children have autism spectrum disorder, which is a heterogeneous neurodevelopmental disorder, which is associated with impairments in social communication and interaction and restrictive and repetitive behaviors. 1 in 54 children in the United States carries a diagnosis of autism spectrum disorder. These children often have difficulty at looking at faces or looking people in the eye, and these behaviors likely contribute to the impaired social communication, which is central to this disorder. Understanding the social and behavioral changes that correlate with improved visual acuity may provide information about the cognitive development of these children, and this understanding may help shed light on the brain-based pathogenesis of autism spectrum disorder. We are presently studying the impact of visual acuity on autism spectrum disorder phenotype. We are studying how the autistic traits of children, as measured by validated surveys prior to refractive surgery when vision is decreased, change after refractive surgery when visual acuity improves. We are also studying how improvement in visual acuity changes the eye tracking behavior of these children. And we hypothesize that refractive surgery has the potential to be a behavior modifying intervention in autism spectrum disorder.